Prime Minister David Cameron is to renew his vow to boost NHS funding and create a 7-day health service in his first major post-election speech. He will commit to a pre-election pledge to increase budgets by at least £8 billion a year by 2020, during his speech at a GP surgery in the West Midlands. The government is also promising to recruit 5,000 new GPS. But doctors' representatives said without detail the announcement was empty headline grabbing. Watch the speech and follow the reaction as it happens on Politics Live. The British Medical Association said the government was yet to explain how it would deliver additional care at a time of chronic doctor shortages. Before the election, the Conservatives gave their backing to a plan by NHS England Chief Executive Simon Stevens to fill a funding gap estimated at £30 billion a year by 2020. This aims to make £22 billion in efficiency savings, with the rest coming from taxpayers. Labour said before the poll that Tory plans for extreme spending cuts threaten the NHS. BBC Health editor Hugh Pym said Mr Cameron had chosen the issue for his first major speech since the election to show there is a real commitment to deliver a 7-day NHS. Death rates. Mr Cameron is expected to describe the health service as the embodiment of one nation politics. He will say the proposals will transform services across the country, with more GPS, faster access to new drugs and treatments. They will also bring a greater focus on mental health and healthy living, he will say. The PM is expected to say it is shocking how death rates for patients admitted to hospital on a Sunday are up to 16% higher than those admitted on a Wednesday, and that a 7-day service would help save lives. Our commitment to free health care for everyone, wherever you are and whenever you need it, he will say. So I believe that together, by sticking to the plan, we can become the first country in the world to deliver a truly 7-day NHS. Mr Cameron is expected to deny that staff will have to work longer hours. He will argue instead that work patterns must be more flexible, to ensure doctors and nurses are available at the right times. Speaking on BBC Radio 4's Today programme, Health Secretary Jeremy Hunt outlined the government's pledge to hire 5,000 more GPS to cover the extra hours and said many existing doctors felt they were in a hamster wheel of 10-minute appointments. Asked how he would achieve this, he said the government would look at the terms and conditions of general practice, ask why it is that GPS have so much burnout, and question what was putting off potential recruits. In order to hit the target, about half of medical school graduates would have to become GPS, he said. They need to feel they are valued, that they are part of the future, he added. Some services, like blood tests, could be offered by nurses instead of doctors, Mr. Hunt said. Difficult questions. The Royal College of Nursing warned any cuts in pay associated with delivering a 7-day health service could lead to industrial action. Its General Secretary Peter Carter told The Independent there was a very modest higher level of remuneration for working unsocial hours, including over weekends and holiday periods. Any changes to that would be strongly resisted, he said, adding, any attack on that and I do fear it would result in industrial action. Mr. Hunt said the body was really jumping the gun. We haven't made any proposals whatsoever about changing nurses' terms and conditions, he said. Dr. Mark Porter, British Medical Association Council Chairman, said the government needed to clarify how it intended to translate this announcement into reality. The real question for the government is how they plan to deliver additional care when the NHS is facing a funding gap of £30 billion and there is a chronic shortage of GPS and hospital doctors, especially in acute and emergency medicine, where access to 24-hour care is vital, he said. Without the answer to these questions, this announcement is empty headline grabbing and shows that even after polling day, politicians are still avoiding the difficult questions and continuing to play games with the NHS. Financial distress. Professor Chris Ham, chief executive of the King's Fund charity, said a 7-day NHS was absolutely the right thing to do, but that money was the key question. He told Radio 4's Today programme the £8 billion pledge is to be welcomed, but that will really help to keep existing services running. It won't fund all the new commitments we've heard of during the election campaign, including 7-day working. He also said there was real workforce shortage in some fields, with hospitals already struggling to recruit enough senior medical staff. Downing Street said the GP Access Fund, set up under the previous Conservative and Liberal Democrat coalition government, was already extending opening hours. Andy Burnham, Labour's shadow health secretary, said pre-election that Tory plans were not credible without investment in extra NHS staff. With the NHS in increasing financial distress, David Cameron must set out clearly how it will be paid for, he said.